This is Chapter 23 and 25, Nursing Care of the Newborn and the High-Risk Newborn. This is a YouTube link providing a newborn assessment. You need to go to this link and watch the newborn assessment. APGAR Scorecard. APGAR scoring permits a rapid assessment of the newborn's transition to extrauterine life. The scoring tool is based on 5 signs: heart rate, respiratory rate, muscle tone, the degree of flexion and movement of the extremity, reflex irritability based on response to suctioning of the nares or pharynx, generalized skin color described as pallid, cyanotic, or pink. This is a picture of an APGAR scoring card. Go to this YouTube video and watch APGAR scoring on an infant. The initial physical exam on an infant. General appearance, vital signs, weight, head circumference and body length is measured, neurological assessment is completed, gestational age assessment using the Ballard scoring system, skin, appearance, color, birthmarks, bruises, lanugo, vernix caseosa, and skin turgor, head, shape and size, fontanelles are measured, open, closed, full, or bulging are depressed. This is also assessed. Eyes, placement, symmetry, blink reflex, both present, equal in size, and checking the pupils. We want to check for reactivity to light and any discharge that might be present. Nose, shape, placement, patency, and drainage. Ears, size, placement, firm cartilage, open auditory canals, assess hearing, do they respond to sounds, face, overall symmetry, low set ears, mouth, the buccal mucosa, is it dry, moist, pink, intact, assess lips for color, pink, or cyanotic. Neck, we want to inspect and palpate for movement and flexibility, any masses or bruises, short and thick folds, webbing, Turner syndrome. This would indicate Turner syndrome. Chest, inspect, palpate, listen, movements, barrel shape, synchronized breathing, retractions, check the nipples for size, placement, number of nipples, are they formed or are they widespread. Breast tissue, any nodules, lack of breast tissue, ears, the size, placement. Faces, overall symmetry, again, low set ears, look for the symmetry of the ears and where they're set. Mouth, buccal mucosa, is it dry, moist, pink, intact. Neck, inspect and palpate for movement and flexibility. Chest, breast tissue, and abdomen, we want to inspect and palpate the umbilical cord, 2 arteries, 1 vein, dried around the base, odorless, round abdomen, possibly palpate the liver. No other masses should be palpable. View the veins. This is a picture of the physical maturity scale that is used on assessment of the newborns within the hospitals. This is a picture depicting the neuromuscular maturity and estimation of gestational age by maturity rating scale that they use within the hospital when they're assessing newborns. Please go to this YouTube video and watch the usage of the Ballard scoring system. The classification system for infants is located in your book, page 664, box 25-1. Classification can be preterm or premature, late term, full term, post-term, and post-mature. It classifies all this information again in your book, page 664, box 25-1. Please refer to that page. Suctioning with a bulb syringe, you want airway clearance, clear the respiratory tract of mucus. Look at your book, page 602. We want to be very familiar with this technique. We want to be able to educate and teach this technique to the parents before they are discharged home. We want to also be aware and know the signs and symptoms of respiratory distress, nasal flaring, retraction, stridor, gasping, chin tug, skin color, cyanosis, mottling, pulse oximetry less than 95%. We want to be able to teach these signs and symptoms to the parents. Body temperature. Maintaining a neutral thermal environment is important for the infant. Cold stress will increase the oxygen demands of the infant. The optimal method of promoting warmth for the infant is skin-to-skin contact. This also will reduce crying, improves breastfeeding, and maintains a maternal attachment. If the infant does not remain with the mother the first 1 to 2 hours after birth, the infant should be placed in a radiant warmer. During all procedures, heat loss should be avoided. Eye prophylaxis is mandatory in the United States and still too as a precautionary measure We want to do this against gonorrhea and chlamydia infections. Erythromycin is the medication that is typically used. Infants do not have the intestinal flora to produce the vitamin in the first weeks after birth. Vitamin K promotes formation of the clotting factors needed in the liver. Indication for vitamin K is used for the prevention and treatment of hemorrhagic disease in the newborn. We never administer it IV, it's given IM. Let's talk about soft tissue injuries after birth. There could be arrhythmia, ecchymosis, petechiae, abrasions, lacerations, or edema. These result from rupture of capillaries caused by increased pressure during birth. Forceps birth and vacuum-assisted births can cause this. Cephalohematoma is another injury that can happen due to the vacuum-assisted birth to the head of the baby. Injuries usually resolve spontaneously. We want to educate the parents of this injury that could happen. If petechiae is persistent for longer than 2 to 3 days, further investigation is warranted. Most newborns will experience some level of jaundice. Most cases are physiologic jaundice caused by increased levels of unconjugated bilirubin. It is self-limiting and requires no treatment typically. The newborn should be assessed for jaundice every 8 to 12 hours. You want to be aware of physiologic jaundice, the types of jaundice that require treatment, and the types of jaundice that require no treatment. Pathologic jaundice can appear in the first 24 hours associated with higher levels of unconjugated bilirubin, and this is the type that requires phototherapy to resolve. Assessment. Assessment for jaundice, we blanch the skin. Area of the skin will appear yellow. Jaundice will first appear in the head, sclera, then the trunk, and extremities. There are 2 types of treatment: phototherapy and exchange of blood transfusion. Exchange of blood transfusion treats infants whose levels are rising rapidly despite intensive phototherapy. This is a picture of an infant receiving phototherapy who has had an issue with jaundice. This is information regarding transfusion exchange for an infant who's had relatively high levels of unconjugated jaundice. The main indication for neonatal exchange transfusion is to prevent neurological complications, kernicterus, caused by a rapidly rising unconjugated bilirubin concentration. We want to read over this exchange information and be aware of what this is. Circumcision. It's the removal of all or part of the foreskin of the penis, usually performed by the MD during the first days of life. Parental decision. Parents need to be informed. Not performed immediately after birth due to cold stress. Feedings may be withheld 2 to 3 hours before due to possible vomiting and aspiration. Please read about circumcision in your textbook, page 615. Care provided after circumcision. Petroleum gauze dressings and/or A&D ointment is applied to the penis to prevent the diaper from adhering to the penis. Page 616 in your textbook talks about different types of anesthesia. Care of the newly circumcised infant. Monitor for urinary output, bleeding, and apply pressure if bleeding is noted, and we want to provide education to the parent. You want to read over the parent teaching box on page 617 in your textbook and be aware of this. Heat loss occurs in 4 ways: convection, radiation, evaporation, and conduction. We've discussed this in our last 2 chapters. You can find this information in your textbook, page 561. Please be aware of these ways of heat loss and know the difference between convection, radiation, evaporation, and conduction. Breastfeeding. Recommended to exclusive breastfeed for the first 6 months of life. It's highly recommended. Breastfeeding should continue for the first year of life. There are many benefits to breastfeeding: bonding, attachment, convenience, cost, reduced risk of otitis media, SIDS is reduced, celiac disease, diabetes, GI infections, necrotizing enterocolitis is reduced, no bottles, reduced healthcare costs. Benefits for the mother are reduced ovarian cancer, breast cancer, type 2 diabetes, reduced hypertension, and reduced coronary artery disease, reduced RA, and a bonding time for mother and baby. This information is in your textbook, page 634. Breastfeeding. Vitamin D is missing in breastfed infants. Read page 637 on vitamins and minerals of human milk versus formula. 10 Steps to Successful Breastfeeding, Box 24-1, page 641. Please read this information. Care and Management of Breastfeeding Mothers, page 640 in your textbook. Please be aware of this information on these specific pages. Skeletal injuries due to birth. Due to pressure during the birth, the infant will sustain injuries or could sustain these injuries during birth. Cephalohematoma is another. The baby has a flexible skull due to the sutures, and there's arteries that lie under the surface of the skull that can be torn due to the pressure during birth, and this can cause bleeding and intracranial pressure. Clavicles, the bone most often fractured during birth. Middle third of the bone can be fractured. Shoulder dystocia, it's an absence of a moral reflex, crepitus, or assessment, or limited arm motion. You want to assess that baby, and if you have these things that are present, you want to think that there might be a clavicle that has been fractured. So assess the baby closely for these issues. Nerve injuries that might be present after a traumatic birth. Brachial palsy, nerve injuries to the arm, correct position of the arm. Pressure during birth to the facial nerve, loss of movement of the face, inability to close the eye completely, drooping of the corner of the mouth. Nursing care is helping mother with feeding techniques to prevent aspiration, may require gavage feeding. See page 700 for gavage feedings and be aware of this technique. Phrenic nerve injury. Phrenic nerve paralysis results in paralysis of the diaphragm. This may cause an airway issue, will likely need ventilation assistance. Position on affected side to facilitate maximum expansion of the lung. Because the injury to the phrenic nerve is usually unilateral, meaning one side, the lung on the affected side does not expand, and respiratory effort is not effective. Drug-exposed infants. Infants exposed to drugs and alcohol are adversely affected. Exposure to the fetus to drugs are varied. They include transient changes in fetal breathing, behavioral changes, and could be fetal death, intrauterine growth retardation, behavioral problems, and cognitive impairment. Signs of withdrawal in neonates due to drugs. Irritability, seizures, a high-pitched cry, fever, mottled skin, poor feeding, and dehydration. See your textbook, page 675, box 25-2. The key factor in treatment of drug-exposed neonates is early identification of substance abuse in the pregnant woman so treatment can be initiated and side effects can be minimized. The degree of withdrawal is closely related to the amount of drug the mother has taken, length of time she has been taking drugs, and her drug level at the time of birth. Nursing care. Neonatal Abstinence Syndrome is identified in an infant. Nursing care is directed at treating the presenting signs, decreasing stimuli, and providing adequate hydration and nutrition, promoting mother and infant relationships. Infants of diabetic mothers. Hypoglycemia may appear a short time after birth. These infants have a higher rate of RDS, respiratory distress syndrome, and CNS anomalies, and intrauterine growth retardation. Please read more of this information in Care Management on page 682 of your textbook. Clinical manifestations of infants of a diabetic mother: large for gestational age, very plump and full-faced, abundance of vernix caseosa, listless and lethargic, possibly meconium stained at birth, hypotonia, which means they have a floppy baby syndrome. Nursing care of the infant. Early examination. Assess for any congenital anomalies. Signs of possible respiratory or cardiac problems. Maintain thermoregulation. Early introduction of carbohydrate feedings, and monitor serum blood glucose levels. Read page 683 in your textbook. RDS, respiratory distress syndrome. Name applied to respiratory dysfunction in neonates. Primarily a disease related to developmental delays in the lung maturation. Responsible for more infant deaths than any other disease. Highest risk of long-term respiratory and neurologic complications. Seen exclusively in preterm infants. Preterm infants are born before the lungs are mature and efficient for gas exchange. This is a critical factor in RDS. Surfactant, surface active phospholipids, are needed for alveoli expansion. Surfactant is not sufficiently produced in the preterm infant. Clinical manifestations of RDS: tachypnea, greater than 60 breaths per minute; dyspnea, pronounced intercostal or subcostal retractions; fine inspiratory crackles; audible expiratory grunting; flaring of the external nares; cyanosis or pallor; apnea. With progression of the condition, you will see vital signs deteriorate. Diagnosis of RDS based on clinical signs and symptoms, assessment, radiographic studies, alveolar atelectasis. Treatment: ventilation, adequate oxygenation, acid-base balance, neurothermal regulation, prevent hypotension, and tissue perfusion. Necrotizing Enterocolitis NEC is an acute inflammatory disease of the bowel. The cause is uncertain, appears to happen in infants whose bowel have suffered vascular compromise. Intestinal ischemia of unknown etiology. Preterm birth remains the most prominent risk factor. The cells in the wall of the bowel stop secreting the protecting mucus. The bowel wall continues to swell and break down. Treatment of NEC is prevention. Oral feedings are held for 24 to 48 hours from infants who are believed to have suffered asphyxia. Breast milk is the preferred enteral nutrient because it confers some passive immunity. Medical treatment of NEC: DC all oral feedings, abdominal decompression via NG suction, IV antibiotics, correction of the extravascular volume depletion and electrolyte abnormalities. Hypoxia and any acid-base imbalance needs to be corrected. Please see your textbook, page 695, box 25-5. This is the end of chapter 23 and 25.